Hello students, Rajvinder here with the new topic, that is Tetralogy of Fallot. And I think you know already the tetra means 4, and the person or child suffering from tetralogy of Fallot, he or she suffering from 4 kind of disorders related to cardiac system or related to heart. Okay. The definition of tetralogy of Fallot is: this condition is characterized by the combination of 4 defects. The first one is ventricular septal defect, pulmonic stenosis, overriding or dextroposed aorta, and the last one is right ventricular hypertrophy. Okay, these 4 kind of conditions present in the tetralogy of Fallot, and these conditions present here. The pulmonic stenosis means the valve of the pulmonary artery, stenosed means narrowed. Then the overriding of aorta shifted from its normal position, and there is ventricular septal defect, the miscommunication or the abnormal communication between the left and right ventricle. Then right ventricular hypertrophy is the fourth condition. Tetralogy of Fallot: 4 abnormalities that results in insufficiently oxygenated blood pumped to the body. And where these conditions are present? First one, pulmonary stenosis, narrowing of the pulmonary valve. Then right ventricular hypertrophy, thickening of wall of right ventricle. Then displacement of aorta over ventricle septal defect, ventricular septal defect, opening between the left and right ventricles. In normal condition, the pulmonary valve in normal condition, that time it receive blood from the right ventricle, and here what happened, now there is pulmonary stenosis, means the valve is narrowed. Okay, then the right ventricle try to flow the blood into the narrow valve, and because of this condition happened again and again, that's why the right ventricle the muscles of right ventricle become hard. That's why there is occur right ventricular hypertrophy. Hypertrophy is the meaning of hypertrophy is the muscles of the right ventricle overworked, due to that it become hard. Then the ventricular septal defect, there is an abnormal opening between the both ventricle and overriding of aorta. What does it mean? Normally the aorta plugged in the left ventricle, but here in this condition, tetralogy of Fallot, what happened, the aorta situated above the ventricular septal defect, and what happened here, the aorta received blood from the left ventricle as well as from the right ventricle. As you know, left ventricle provide the oxygenated blood to the aorta for systemic circulation, and right ventricle have blood with less oxygen or deoxygenated blood is there, and both blood mixed, deoxygenated blood and oxygenated blood mixed, and the aorta receive the mixed blood, and mixed blood give to the whole body or whole body system. That's why in this condition the child becomes cyanosed. It is a cyanotic heart disease condition. Child becomes cyanosed. Why? Because in the systemic circulation the child receive the mixed blood. Fine. Then the next is incidence. It is the most common cyanotic heart defect and the most common cause of blue baby syndrome. What does it mean? Blue baby syndrome means when baby suffering from insufficient blood supply due to receiving the mixed blood from the aorta in systemic circulation, that time child show the symptom like the lips of the child become blue, the nail beds become blue, and the child feel difficulty in breathing. Okay, it accounts for 6 to 10% all cardiac heart diseases. Okay, then the next is causes. The causes of this disease not clear at this time. Okay, children born to mothers with, might be this reason, children born with PKU phenylketonuria, it caused the genes abnormality. When the mother suffering from phenylketonuria, that time the child might be suffering from cardiac disease, cardiac condition, that is tetralogy of Fallot. Okay, as are mothers who drink during birth, how the drink affect on the child and child suffered from tetralogy of Fallot? Because during the pregnancy, when the child become in the exposure of alcohol, that time the child may be suffering from or cause fetal alcoholic syndrome. Okay, because of that, after the birth, might be due to the fetal alcoholic syndrome, the brain of the child become damaged or other kind of conditions happened with him or her. Then genetic, if this condition or cardiac disease is running in the family, that is also become one of the reason. Then the next is, this is the exact circulation of the heart happened in tetralogy of Fallot. Here you can clearly see the blue color in the circulation. We can see the blue in right atrium, right ventricle and pulmonary artery, and in the left atrium we can see red color because there is oxygenated blood, and after the blood pour in the left ventricle, that time it become purple. Why? Because here the blood mixed, blue or red blood mixed, and it become purple mixed blood, and this blood go for circulation in the systemic circulation. Okay, pathophysiology, what happened in tetralogy of Fallot? Actually, physiologically, the pulmonic stenosis means narrowing of the pulmonary valve causes concentric right ventricular hypertrophy. How? Because normally the pulmonary artery receive blood from the right ventricle and give it to the lungs for purification, and here what happened, when pulmonary artery, valve of the pulmonary artery stenosed or narrowed, that time the exact quantity not taken by the pulmonary artery, and the most of the blood present in the right ventricle. Right ventricle put their effort to give this blood to the pulmonary artery, and the right ventricle try a lot to flow blood in the narrowed valve, and that time what happened, the muscles of the right ventricle become hard due to overworking, right? Then right ventricular hypertrophy without cardiac enlargement and an increase in right ventricular pressure. As you know the reason, when the right ventricle pressure is as high as the left ventricle or the aortic pressure, a right to left shunt appears to decompress the right ventricle. Okay, when right ventricle have a high pressure, that time it give blood to the left ventricle. Why? Because there is a VST also present, ventricular septal defect also present, and there is a shunting from right to left are going to happen to relieve the right ventricle. Then once the right and left ventricle become identical, how? Right ventricle pour blood into the left ventricle, and what happened after some time, the right and left ventricle become equal and there is equal pressure in both. Then increased severity of pulmonic stenosis reduces the blood flow into the pulmonary artery and increases the right to left shunting. What happened? When the pressure in the right ventricle become high, that time the aorta also situated above the ventricular septal defect. Here what happened? Right ventricle do not give blood to the pulmonary artery, not sufficient blood give to the pulmonary artery, because the right ventricle feel hard to give blood to the pulmonary artery because there is a stenosis. And here the right ventricle flow the blood into the aorta, and here aorta receive the blood from right ventricle and left ventricle, and here is mixed blood collected. Then flow of blood into the pulmonary artery and increases the right to left shunting. Okay, as the systolic pressures between two ventricles are identical, means equal, similar, there is little or no left to right shunting. There is no shunting, equally they are situated, and the VST is silent. Ventricular septal defect is silent. They do not flow blood in the left or right side. Okay. Then what happened next? The flow from the right ventricle into the pulmonary artery occurs across the pulmonic stenosis, producing an ejection systolic murmur. What is the ejection systolic murmur? When we heard the sound of the heart with the help of stethoscope, that time the abnormal sound occurs, begins the first heart sound and ends before the second heart sound. You can also say the ejection systolic murmur is the abnormal heart sound which we can heard with the help of stethoscope. Then more severe the pulmonic stenosis, the less the flow into the pulmonary artery. Means more narrowing the pulmonic stenosis, more narrowing the pulmonic valves, the less flow of blood received by the pulmonary artery and less blood pour into the lungs for purification. And the bigger the right to left shunt, more the cyanosis, because there is very less oxygenated blood. That's why the baby becomes cyanosed. Cyanosis means discoloration of the skin or the bluish color of the skin, right? Then the next one is, thus the severity of cyanosis is directly proportional to the severity of pulmonic stenosis. The more the pulmonary valve narrowed, the more the cyanosis occurs in the baby. Okay, the VST, ventricular septal defect or tetralogy of Fallot, is always large enough to allow free exit to the right to left shunt. That's why VST play a big game here. Then in the tetralogy of Fallot, congestive heart failure never happened. Okay. What comes next? That is clinical manifestations. Clinical manifestations, it depends upon the size of ventricular septal defect and degree of right ventricle flow obstruction. Right. Then blue baby. What does it mean, blue baby? Cyanosis, when baby cyanosed specifically from lips and nail beds with dyspnea. Dyspnea means difficulty in breathing, is found initially with crying and exertion. When baby cry, suffering from blue syndrome or blue baby syndrome or become blue, then or exertion, when the baby play or indulge in any kind of activity which need more energy, that time he or she also suffering from cyanosis, specifically lips, nail beds, and along with difficulty in breathing. Then tired easily with exertion, may have difficulty in feeding, because feeding also needed energy. Then sign of chronic hypoxia, harsh systolic murmur, it's also abnormal sound we can hear, often accompanied by a palpable thrill. In radiograph, the heart is boot shaped because the poor development of pulmonary artery. What happened here, the right ventricle, when right ventricle overworked or overburdened, that time the shape of the right ventricle looks like a boot shape in radiography or in x-ray. Okay, then normal growth and development depend on a normal babies who have tetralogy of Fallot may not gain weight or grow as quickly as children who have healthy heart because they tire easily while feeding. The baby suffering from tetralogy of Fallot, they gain weight or grow as quickly as the healthy baby can. Then squatting. Squatting is a technique or is a method which gives relief to the child. When child doing any work or having exertion due to some activities, that time child sit. As you can see on the image, child sit, and this position give relief to the child, give symptomatic relief to the child. How? When child take the squatting position, that time what happened, the cardiac output or cardiac flow more, and that time what happened, the pulmonary artery take more blood to give to the lungs, and that time the required or some but little bit less than required oxygenated blood received by the baby heart. Okay, squatting, a compensatory mechanism, is uniquely characteristics of a right to left shunt. Because of this position, the right to left shunt stop for some time, because left pulmonary artery pulmonary artery take more blood and give to the lungs. Okay, right to left shunt that presents in the exercising child, squatting increase the peripheral vascular resistance, which diminishes the right to left shunt and increases pulmonary blood flow. When pulmonary blood flow increase, what does it mean? Lungs receive more blood, lungs pure more blood, give oxygen to give oxygenated blood to the heart, and baby feel comfortable. Then TET spell. TET spell, hypercyanotic spells. When baby cyanoster, as you see in the picture, lips are blue, hand or the feet also become blue. Okay, due to cerebral anoxia, it consists of irritability, child become irritable, difficulty in breathing, discoloration of the skin, less energy or feel weak with or without unconsciousness. It is found in the morning, after awakening, or during or after feeding, and after the painful procedure. Fine. Then the next is causes of spell. Due to spasm or contraction of a band of muscle in the right ventricle just under the pulmonary valve, when this muscle contracts, it further narrows the channel for blood flow into the lungs. As a result, oxygen delivery becomes further reduced. This causes a spell. That's why the child shows symptom, becomes cyanosed and suffering from tet spell. Then clubbing. What happened in clubbing? In clubbing, our nail of the hand looks abnormal. Clubbing of fingers or toes. Then diagnostic evaluation, history collection. In history collection, we can know about the conditions, what happened with the child earlier. Then physical examination, there we can see clubbing easily and cyanosis also. Then heart sound, normal first sound, single second sound, and an ejection systolic murmur means the abnormal sound we can heard with the help of stethoscope, beginning of the first heart sound or before the second heart sound. ECG, right axis deviation and right ventricular hypertrophy. ECG can show echocardiography, identify the large overriding aorta, right ventricular hypertrophy and outflow obstruction. Then cardiac catheterization is cardiac catheterization done here to know the position of the organs and internal organ of the heart. Then boot shaped heart, because there is the shape of the right ventricle away than the normal, that's why it means apex is lifted up and there is a concavity in the region of pulmonary artery. Then oligamic lungs field, Hiller vessel are few lung vessels, also few large right ventricle. Then oligamic lung is total volume of blood reduced here. Hiller, the meaning of Hiller is little vessels or few vessels. Then the next is medical management, monitoring for hypoxemia, hemoglobin level and hematocrit values may be evaluated to assess anemia, monitoring for hypercyanotic episodes 10 to 15 minutes and balloon dilation of right ventricular outflow tract. Then the next is treatment of spells, knee chest position, it gives relief from the symptoms. Knee chest position to increase aortic resistance. The increased aortic and left ventricular pressure reduce the rush of blood through the septal hole from the right ventricle and improves the blood circulation to the lungs. Then oxygen therapy is also good for this condition. Then beta blockers such as propranolol. Acute episodes may require rapid intervention with morphine to reduce ventilatory drive, and a vasopressor such as epinephrine, phenylephrine or norepinephrine to increase blood pressure. Then surgical management. The first one is Blalock Tossing operation. What happened in this? Connection between the right subclavian artery and the right pulmonary artery, which increases the amount of oxygenated blood reaching the lungs, relieving cyanosis. Then Potts shunt, descending aorta is anastomosed to the pulmonary artery, and Waterstone's shunt, ascending aorta, right pulmonary artery, anastomosis. Next is this picture. You can clearly see after the surgical management this kind of circulation going to happen in the patient suffering from tetralogy of Fallot. Then the next one is total correction. The hole in the ventricular septum is closed with a patch and the obstruction to right ventricular outflow, pulmonic stenosis is opened. These corrections allow blood flow to the lungs for oxygenation before being pumped out into the body. And the complications, brain abscess, it can cause brain abscess, bacterial endocarditis and ventricular arrhythmias. I hope you can understand this lecture. If you feel any kind of problem, kindly inform me. I will try to help you and feel very happy to help you. Stay at your home, take care of your elder. Good wishes for you. Try hard